pelvis is an integral part of the human body. And pelvis itself is responsible for a significant portion of happiness one experiences. Whether it could be as simple as emptying your bladder, evacuating your bowel, and the sexual function, of course. When there are problems related to the pelvis, such as a cancer in the pelvis, one goes through radiotherapy, operations in the pelvis, where there is risk of damage to the nerves, or prolapsing organs in the pelvis, difficulty with the normal pelvic functions such as urination, difficulty expelling the stool, diarrhea with incontinence, or bloody stools as a consequence of radiotherapy or the operation itself. These are the conditions that are dealt in our pelvic happiness clinic. It is a multidisciplinary clinic wherein there is involvement of a colorectal surgeon, a gynecologist, and a urologist to undertake evaluation of the pelvis and intend to provide care and try and cure the symptoms arising from pelvic problems. It is a one-stop clinic for any pelvic problems as a consequence of either previous treatments or without any previous treatments. We tend to run these clinics on a Saturday. It is a multidisciplinary clinic wherein a patient presents with any pelvic problems, a thorough history is undertaken, relevant clinical examinations are undertaken, which should include a proctoscopy, a pervaginal examination, as well as basic investigations such as hematological, biochemical, and urinary investigations. Where situation dictates, endoscopic examinations could be done in addition to radiological investigations. But the aim is to find out any pathology within the pelvis when one presents with pelvic problems and try and provide them a cure and manage their symptoms so as to improve their quality of life. Cancer treatments bring with them a lot of short-term, medium-term, and long-term problems for the patient who has had cancer treatment. In a short term, patient is troubled with post-operative complications, coming into terms with the cancer diagnosis and treatment. In a medium term, he is recovering and trying to build on with his energy and trying to get back to his normality. Coming to term with the psychological distress is part of the process. In a long term, the treatment effects can last, leading to problems. For example, when patients have radiotherapy to the pelvis, patients can be troubled with radiation proctitis, where there is urgency to pass stools and bloody diarrhea. They can have radiation-induced cystitis, where there is urgency and urinary frequency. There can be strictures associated with radiotherapy. And also sexual dysfunction, erectile dysfunction, chronic perineal pain, all these can be a consequence of the treatments we give. In addition to radiotherapy, what we do as surgeons operating deep down in the pelvis can lead to damage of the nerves and can lead to incontinence and troublesome symptoms in the pelvis. These symptoms need to be attended to, not only organic symptoms, but also functional symptoms. As a colorectal surgeon, we do a lot of rectal cancer work, sometimes with radiotherapies, majority of the times without radiotherapy. They are troubled by something called as an anterior resection syndrome, which is hugely troublesome for the patients. And this is where we not only diagnose complications as a consequence of rectal cancer treatments or pelvic cancer treatments, but we also manage them in a multidisciplinary setup using both medications, pelvic floor exercises, psychotherapy, etc. What is less attended to is the psychological state of the patient, because depression is a common consequence of post-cancer therapy which is thoroughly ignored. We have trained psychotherapists, and there is also help from psychiatrists where there is an indication for this to be looked into. So the LAC clinic, also termed as Life After Cancer Clinic, attends to the symptoms as well as the psychological state of the patient, and also allay any further fears related to a cancer. We run this clinic once in a month. It's a Saturday, and any complications related to cancer and its treatment will be attended to. Not only in the pelvis, if there are stomas or bags, hernias related to that, incisional hernias related to post-surgical problems, psychological problems such as depression, anxiety, the worry that the cancer might come back, or it could be as simple as what the follow-up pattern will be for post-cancer treatment. All these will be dealt with in the Life After Cancer Clinic. This is aimed to pick up any problems as well as to improve one's quality of life. Thank you very much.